Hi, this is Todd Mobbs. In my video series, A Senior Healthcare Hell, I've been telling you about my father, Lee Mobbs' healthcare experience. In this video, I like to address the problems we had with the Department of Public Health in Los Angeles. I made my first complaint to the Department of Public Health in Los Angeles regarding the bedsores on my father at Kindred, Los Angeles in mid-August 2006. I made a follow-up call October 20th, 2006, the day after he left. I've made several follow-up calls. I've spoken to Supervisor Eric Stone at least a dozen times. At one point I offered to send them a letter with photos detailing my complaint. They said a couple of times that I could not do that, that they could not accept that. Eventually they said they would, and I sent it to them, but they said they did not receive it. They told me several different reasons at different times why they cannot accept this. They eventually investigated the bedsores. November 19th, 2007. They did not inform me until October 1st, 2008 because the facility, Kindred, did not give them a plan of correction until sometime in September 2008. My substantiated complaint against Kindred for the bedsores is not available on their website. I made a complaint against Hancock Park Rehabilitation in Los Angeles, California, sometime in December 2006, with another follow-up call. As far as my knowledge, that has not been investigated, unless the Department of Health is waiting for a plan of correction from the facility. I've also made a complaint against Topanga Terrace Convalescent Center in Los Angeles for their hostilities and other care issues regarding my father after the Department of Health's first visit. As far as my knowledge, that one has not been investigated. A hospital which he visited during his stay at Topanga Terrace also stated that they made a complaint to the Department of Health regarding my father's care at Topanga Terrace. The Department of Health claims they have no knowledge of that. The Department of Public Health has been reluctant in accepting photos and a written complaint from me. For whatever reason, I do not know why. I had permission by these facilities to take photos. Even though I asked, they were very paranoid. They did say I could take photos of my father. After an incident at Kindred, Los Angeles, where I witnessed an altercation of physical abuse involving my father, I took photos of the aftermath. Kindred's Director of Quality contacted me and then said I could not do that. At one point, he threatened to call the authorities on us. We told him, go ahead and call the authorities. I'm sure they would like to see these photos. He got very angry and disgusted and told us we better keep them to ourselves. When a facility, in my case, Kindred Hospital, Los Angeles, outright lies to you, and you see this with your own eyes, and your loved one is in immediate harm, you're going to take photos when it's your only defense. Once I observed some neglect at these facilities, I would tell the administration if I see further neglect, I will take a picture of it. Their response was that I have nothing to worry about, that your father is in very good hands here. Speaking of photos, the photos I have posted of the decubitus ulcers, bedsores, have been believed to have been taken at Kindred. We don't know by who. Kindred has denied possession of such photos. I'd like to also tell you about the problems with Social Security. They would not give my father Social Security checks because she did not have proper ID and was unable to obtain ID because of new laws. After she passed away, they made me his responsible payee, but then they informed me that the checks could only be used for his medical expenses. They were not cashed. After he passed away, they notified me for an overpayment. I told them that I did not cash the checks and offered to send them back. They wanted me to send them $1,700 and some dollars. I did not, and they put a government lien on my credit for $1,700 and some dollars. They are very unreasonable to deal with. They absolutely refuse to take it off unless I send them an extra $1,700. All I was interested in was the money that she should have received during the time of her living to pay her bills and etc., which I paid. Nothing more. This is a very important time in this country, for when or if there is a change in our healthcare system, that the prevention of neglect and abuse is strongly addressed, so these problems do not continue to happen. Thank you for watching.